Welcome to Side Effects with an A. When effect is normally used, it's a noun. It's already occurred.
Effect is a verb meaning action. Action influences outcomes.
I'm Scott McGohan.
And I'm Anne-Marie Singleton. We will provoke you to think differently.
Side Effects, where problems are defined, solutions exposed. All right, Side Effects. Welcome to Side Effects. I'm Scott McGohan.
And I'm Anne-Marie Singleton.
We have a lovely guest with us today, Kim Snyder.
Hi, everyone.
How are you?
Oh,
I'm good. How are you? Happy Friday.
thanks for being here.
Kim's with McGohan Brabender. We'll talk about where she came from and her experience, and we're going to talk a lot about maybe serving customers and how do we do that in a different way. How's your beginning of fall going?
It's going well. Started school and kids are back in. I'm a little out of my mind, but this is a great time in Ohio. The fall weather is going to be lovely. So how are you?
Good. So we're in that season of life where our friends' kids are getting married.
Oh,
Yeah. So we're going to a lot of weddings.
you went to one last weekend.
I did.
Yeah.
I did. And it was pretty funny. So I played golf with my friends in the morning, which my wife was not a big fan of. And we came back around 2:30. We have to be ready by 3.
Oh,
Well, it only takes
typical
guys like
dude move.
5 minutes,
Right.
maybe 10 at the
yeah.
best.
Okay.
But I get out of my wife's car and it won't lock, and I have no idea why. But so I have to pull the key out and the fob and figure out how to lock it with these keyless. Like I don't know how to do that anymore. It doesn't have a key.
Right.
So I lock it, and then we go to the wedding, and we get back around 12:30, and I wanted some Sour Patch Kids, so we're in the hotel lobby. I walk across the street to this little convenient mark, and I look in the parking lot, and I'm like, oh, my wife's lights are on.
Oh no.
So the car doesn't lock with the lights on. I'm like, okay, that's kind of cool. I'd get my head around that.
Okay.
So I run up to the room, I grab my keys, I come out, I get very close to the car. It's running.
Oh no.
So it ran for about 9 hours.
Oh my gosh.
And then I made the fatal mistake of telling my wife and all my friends this awesome
And
story.
now you've just told the rest of the world.
did,
So,
I did, so-
yes, even you make a mistake.
So I need
sometimes,
customer
so-
care.
Yeah. Oh my gosh.
I need a lot of
You
care.
need more than
Big
you might
time.
need a referral. So we'll talk about that
Yes.
after. But at least your battery wasn't dead. I
Exactly.
mean, there's the silver lining,
I
right?
had no gas. Other than that, we're fine.
Oh
we're
my
fine.
gosh, that's hilarious. Well, yeah, I'm not sure that you have the magical powers to help Scott with that.
No.
But you are able to help people with lots of things. So tell us a little bit about yourself, Kim. How'd you get here?
Well, I've before MB, I actually spent about 25 years in the pet industry.
Oh,
So I'm
don't
used to
think I knew
veterinary
that.
medicine,
Okay.
but there's some that translates over into the human medicine aspect.
What company is that?
So I worked for the IMS company.
Fantastic company.
I love that company.
Yeah, amazing.
Amazing. And so this was a change for me, but I love it. I'm learning so much, and it's really empowering to be able to help people, and that's very rewarding. And the team that we have, the customer care team, is very passionate about doing that.
yeah. So talk a little bit about customer care, because I think we were specific when we used those words. I think to call that advocacy area customer care. Can you tell a little bit about what you do in there and who's calling you?
Sure. So our client employees call us. They can call for a variety of reasons. Simple questions like, is this bill correct? Should I pay it? Or benefit questions. We also handle a lot of really involved claims, and we help sort that out. It's so confusing for so many people. And so we are there to advocate, do the legwork for them, and help find solutions.
It's funny. So about probably 12 years ago, we had a customer call, and they said, hey, I've got a claim problem. I need to talk to somebody. And Kathy at the front said, well, we'll put you through to customer service. And then sarcastically, he said, yeah, great. That's where I want to go.
Right.
Customer service. Because the perception of customer service, unfortunately, for a lot of industries, is
Right.
like returning something at a department store.
Right.
Right. Or calling to not to pick on cable, but calling to get your cable bill or have a
Exactly.
question.
Well, you just picked on cable,
I
so.
did. Well, I mean, any service industry, but any big, it's not a good experience. Like, I don't want to call when my cable's out. I'd rather just throw it out and
Yeah.
start over.
Right.
Well, and I think what's interesting is, so we spent a lot of time with your team, and we just vetted a lot of different names, and it came, a lot of different words came out, and then this just word that was just sitting there was this word, just care. So why don't we just say we care?
Right.
Because in your experience, I mean, most people, and you would agree that insurance is really intimidating.
Right.
It's really misunderstood. And they get these bills in their mailbox, and it scares them to death.
Right. I mean, most people don't call us to say they're having a great day
Right.
at all. They definitely don't call customer care to say, we're having a great day, how are you guys? They're calling because they have a problem or an issue, and they are scared, and they do need help. And most times when they've used healthcare, they're sick, hurt, injured, so that complicates it even more, because emotionally, that's a very tough transaction aside from the financial piece of it.
Yeah, can you imagine? So if you went to Best Buy and you bought a TV, but you didn't have to pay for it right then. And then you came home and you got this bill and it said you owe $4,500 for this TV,
Right.
but wait for us to adjust it later.
Right.
Right.
Like, you would freak out.
Right.
So is it going to be $100? Is it going to be $300?
Right.
And so I think
Should
sometimes
I keep watching it? Should I
Yeah,
return it?
exactly.
You can't do that with your health care.
And so, as families, obviously, healthcare is really expensive as they're struggling, or not even struggling, but they get this information and they're stuck in this fear. And your team, I think one of the greatest gifts you guys do is, like, you're really good listeners.
We are, and the team is very passionate about problem solving, and so they always want to do the right thing for our members, and they go above and beyond. They will exhaust every option to try to help one of our members, and that is really important, and I think keeps the team going on a daily basis. It's confusing, and employees get confused by it, and so we're there to help explain, help educate, and ultimately try to resolve their problem.
Yeah. Is there anything, I mean, not personal details, but is there anything like you can talk about that was interesting or curious that you guys worked on in the last, 6 months?
Yeah, I mean, all the claims are different, and that's the beauty of it. I mean, you don't have two that are the same, but one that sticks out in my mind is we had a gentleman, he had to have a kidney transplant, and to prevent the transplant from rejecting, he had 4 injections, a series that he had to go through, and each cost about $8,000. And 2 were denied by insurance. So he spent over a year trying to work this out between the hospital and insurance, and then finally called our team. And we were able to help resolve that and work. We were that conduit between the hospital and the insurance company. We worked on this for a couple months, and we were able to get those reprocessed, ultimately saving him almost $20,000.
Wow.
Yes.
That's
And so
a big
we
deal.
keep track of the savings that we drive back from employees and even employers. So your team year to date has saved employees and employers roughly about $500,000
Correct.
to
Yeah.
date, which is amazing.
It is.
But I think a lot of times, if you're an employer, your employees have access to the carrier,
Right.
and the carriers do a good job. And this system now is mostly electronic, so the majority of claims are processed electronically. So the amount of claims that we get problems on have reduced, and they've done a good job. But when people run into really big problems, what they don't want to do normally is call a big clunky insurance company.
Right. They're intimidated by the 800 number, or they're intimidated by the first line person who takes the call. There is a process. I mean, there's a first line person who takes the call, and then there's an escalation process. If you call a large company, that's how their lines are going to work. And not that there's anything wrong with that. It's just the process that you have to go through. The issue is, as you just mentioned, is a lot of things are processed electronically. Starts with some human input, right, at the provider or the facility, and then once it gets input into a system, a lot of it's electronic. So there's not a lot of check and balance on it. It's just whatever code got entered gets paid or gets rejected based on a diagnosis code. So there could be a mismatch in how it's billed and how it's coming in. That's what creates the problem. Then as a member, as Scott said, you get an explanation of benefits that says, here's what we did, we'll send you a bill. Then you get a bill from the provider, and they don't match all the time. And then you're like, well, what should I do? So some people just pay it all, and they don't owe it. Some people don't pay it at all because they don't think they owe it, but they don't know how to resolve it, and then it hurts their credit. So I was reading some statistics. There is no single source that everyone agrees to on medical errors being billed out there. They happen in every industry where there's human intervention. Some studies say it's 30 to 40% of bills. I've read others that are specific to Medicare that say 70 to 80% of bills contain errors. That,
Wow.
I mean, that's gigantic, whether it's 30% or 70%. It's a lot.
Yeah. We actually have that conversation a lot back with the team. The folks that do contact us and we are able to help, we think about those that don't. They don't have us as an option. They don't think about it. They just pay it. And how many are paying money that they don't necessarily owe?
Yeah, so if you think about it's hard to get money back from an insurance company.
Right.
You'll get it, but getting it back from a provider is even
Very hard.
harder, really difficult. And one of the things that so we have is a team of people. So what I love about this process is a problem goes to a belly button, a person, right, from start to finish.
Yeah.
So if I'm a customer, I don't have to call and like tell my story over and over again.
Right.
And you, as the leader of that team, you just keep track of those. So I think year to date, we're around 6,000 issues have come through the phone.
Right.
And then your team is responsive in getting back to people. But what we're really taught to do is to create experiences for people, to kind of call them out of the trees, let
Right.
them know that we're on their side, that we don't work for an insurance company.
Yeah.
Right.
Yeah.
Talk a little bit about sometimes members asking a question. They're asking a question that you could answer another way. They're using the wrong terms, like
Oh,
deductible,
gosh.
copay, coinsurance.
Yeah, it does happen quite frequently. It's very confusing, so they don't understand what the terms mean. And so oftentimes folks misunderstand they've met their deductible, but they haven't met their out-of-pocket max. And so we have to explain that in a different way. Or if they've gone to an out-of-network doctor, that goes to a different bucket. And so that confuses them. Instead of their in-network deductible, went to their out-of-network deductible. So there's all kinds of confusing terms, and we're here to help. And it's
Yeah, the
really
story I heard the
rewarding.
other day was, so somebody called and they had a $3,000 deductible and they had met it. And they called the insurance company and they said, yeah, we'll adjust that. It'll take about 30 days. Well, in the meantime, they go get a prescription and they're a diabetic and it's $400. And I'm like, well, I've
right.
already met it. Why do I have to pay for this? And what was terrific about your people is they said, that's unacceptable. 30 days is not acceptable. So how do we speed this up? And within a short period of time, that was met. The member was taken care of. They got their prescription. They didn't have to pay $400.
Right.
All because we just have a building full of people that just really, really care about people.
Yeah. I think that what makes this even more important in our industry is, like you said, it's not a TV that we can return if we didn't want the price. We've already had the service. Now we're on the hook, right? And you think about a household and it's like, well, it's us and this big hospital or this big insurance company. I don't have a fighting chance. I guess I'll just accept what they sent me and pay it. So it's confusing. We can't check the price ahead of time. We've talked about this before. We need the service, but we need to understand how much is it and am I paying the right amount? In addition to that, though, I've had you help some folks before who've called me and said, hey, look, we have an employee who has a new diagnosis. What can we do as an employer to help them? And so I've sent folks back to your team where you guys work to get a patient advocate from the carrier to reach out to them and start to help them manage that. So it's even beyond just adjusting a bill, which is one of the biggest things that we work on.
Absolutely. And, you know, there are certain situations where there isn't anything we can do and we're not able to help solve the problem, but the team really goes above and beyond and we'll do whatever we can to help. It may just be answering a question or explaining something. Sometimes we just have to explain something in a way they can understand it. So
Yeah.
Yeah, well, it's confusing, it's intimidating. Most people's reaction to a problem normally is the madder I get, the better the result I'm gonna receive on the back end.
Right.
Especially when they don't understand it. And let's face it, we say, you know, EPO, PPO, HMO, HSA, HRA, FSA, and they're looking at I have no idea what you're talking about.
Yeah.
And what we're able to do in your team is we're able to give them an ear, right? So someone to talk to. And we think most importantly is like a gigantic heart, somebody that's on their side, that can help them along the way.
Right.
So you'll help with like enrollment issues from like HR. Hey, this person's not showing up. They can't get their ID card. We've helped people with prescription drugs through pharmacies. We have a rule here at McGohan Brabenders: do the right thing every time, all the time. So there is, you don't have to call. You don't have to call Ann or I, say, hey, should I do this, right? You lead
Right.
with your heart first.
We do.
Right? And you just take care of people.
Yeah.
So we want to, thank you for trusting McGohan Brabender, because you came from an amazing company, the
Yeah.
IMS company.
Yes.
And let's hope that you landed in an amazing company,
I did.
McGohan Brabender.
I love it.
Thanks for leading your team
Thank
and just everything that you do.
Thank
We're just
you.
grateful.
Glad to be here. Thanks
Yeah.
for having me.
Yeah, no.
So we have resources on our website, healthierbirthdays.com, and we have also put together this really cool sheet of information around maybe what customers might want to consider when they're using healthcare, a fact sheet. So if you're interested in that, check us out at healthierbirthdays.com, and we want to thank you for joining us on Side Effects.
Thanks, everybody. Have a great week.
Take care.
Thanks for listening and opening your mind. If you're interested in learning more, you can reach us at scott@healthierbirthdays.com.
Or Ann at healthierbirthdays.com. We hope you'll join us next time
On Side Effects.